Yesterday, and I said, I've got to talk about this. Um, I want to talk about the menopause education crisis in medicine and why women deserve better care and how to demand it. There's an article I'm going to show you where in California they're trying to mandate medical education on menopause. And the problem is where's the education coming from? And again, I've been on this road for over 25 years. And I spent 10 or 15 years speaking to lay people and doctors, talking about how to handle women's hormones. And I see that there's a whole new group of people. This is a whole new generation of people going through perimenopause and menopause. And somebody has to be the advocate. And I am tired of trying to convince doctors. And what I have found out is that doctors will listen to patients more than they'll listen to other doctors. And that's why the pharmaceutical industry tells you about a drug and then they say, hey, ask your doctor about it, because the patient has to make the doctor aware of the medication. And a lot of times that's when they will change what they're doing. So I'm going after the public. This is not a hard concept to grasp. And so I'm asking you to help me spread this message, to ask your doctor about this. All right. So menopause education crisis. So why is there a crisis? Well, here it is. Now, every woman over 50 is going to have to deal with menopause. Okay. If you live long enough, you're going to have to deal with it in the United States. Now, yet most physicians are inadequately prepared to help them navigate this critical transition. Only 9% of US medical residents feel prepared to treat menopause symptoms effectively. Now, I've been doing this for 25 years, and they're still not teaching doctors how to do this. And if they are, they're teaching them the wrong information. Women are left to navigate confusing, dismissive care during one of life's most significant hormonal shifts, often feeling unheard and unsupported by the medical community. Yes, here's what happens. If doctors aren't up on something, then they're down on it. Okay. So if they're not up on how to take care of women with menopause, then they're just trying to end the conversation as soon as possible, get you out of the room so you'll stop complaining. And I'm just telling you the bare facts of how doctors think. All right. So why are they still unprepared? They have inadequate medical education. Medical schools offer little to no specialized menopause training, leaving physicians without fundamental knowledge about this universal female experience. And I know some of you have heard some of my other videos. This is not a difficult concept. When patients go through menopause, their ovary they stop ovulating, they stop making progesterone. All women stop making progesterone because all women stop ovulating. All women, not all women, but most women over 50, they can't get pregnant anymore because they don't ovulate. They don't make an egg. The one hormone that is dependent upon ovulation is progesterone. It's not estrogen. It's not. Doctors follow inconsistent guidelines like those by the North American Menopause Society. I'm going to show you that. They're the ones who come out with position statements trying to tell doctors how to treat menopausal women. But this is often based on expert opinion rather than robust clinical data and evidence. So, an expert is just somebody who's from out of town who has a briefcase, or somebody who's written a book. They think they're an expert. Now, I've written a book, okay? So, but I do think I know what I'm talking about. But the North American, just because they're an expert, that means nothing. Okay, again, truth truth outweighs authority. Just because they're an expert doesn't mean that they know what the heck they're talking about. No hormone testing protocol. Physicians receive minimal training in testing hormone levels before prescribing treatments. That leads to a one-size-fits-all approach. And 30 years ago, when I was in medical school, over 30 years ago, we never tested for hormones in the blood. We never tested anything because I didn't learn saliva testing in school. I had to learn it on my own. But we never drew blood for hormones because it doesn't tell you anything. And I can show you, I've done that on previous YouTubes, that the textbook says serum measurements of hormones has limited clinical usefulness. All right. So yeah, they have no data to go by. So you have to go by these experts. And most of the experts are paid by the pharmaceutical industry. All right. So what doctors aren't taught? They're not taught to test before treatment, to measure your individual hormone levels. And even if they do, if they uh, trick you into thinking that they're getting some information from your blood levels, they're not. They're just doing it to appease you, to make it look like they're doing something. Then they give you the same thing that they're giving everybody else. Saliva testing benefits. To use saliva testing that accurately reflects bioavailable hormone levels in tissues where hormones actually work. The action takes place in the cell, not in the bloodstream. The bloodstream is like an interstate highway. It takes something from one place to another and it drops it off. And wherever it's dropped off at, that's where the action takes place. The blood is not where the activity resides. So to treat menopause with the same scientific rigor used for thyroid disorders or hypertension, how do they test your thyroid? They look at TSH, free T3, and they base it off of those numbers. Hypertension, I give you a blood pressure medication. I check your blood pressure to see if your blood pressure has gone down. If it's gone down too much, I back off the hypertension medication. If it hasn't come down enough, I might increase the dose. But I base my treatment on actual numbers based on that actual patient. Now, why can you test for thyroid and not test for estrogen and progesterone? Because thyroid hormone is water soluble. It's easily tested and accurately measured in blood samples. Blood tests provide reliable data for those treatment decisions. So if you're looking for sodium, potassium, thyroid hormone, anything that is water soluble, yes, you can use the blood for that. But fat soluble hormones like estrogen, progesterone, testosterone, they're fat soluble. They're primarily stored in tissues, difficult to detect accurately in blood. Blood levels may appear normal while you're still experiencing significant symptoms because it's not telling you where the hormone is actually doing something and what is that ratio between that estrogen and progesterone. All right. Now, you guys don't remember this. So this is back in 2002. Now, I graduated from medical school. Well, I finished my residency in 1990. And back then we were given Permin and Provera. And everybody kept saying, wait till this women's health initiative, this big study comes out, then it's going to eliminate all the confusion. Well, what it did was we thought everybody, well, the medical community and what I was taught is that everybody needed estrogen. And the Women's Health Initiative debunked that theory. And so here it is. It dramatically changed how doctors approach hormone therapy, but its findings were widely misinterpreted. So everybody was saying, "Hey, wait till uh, this Women's Health Initiative comes out. It's going to explain everything. It's going to explain how all women need estrogen." Then they said, "Wait a minute. This study is saying estrogen increases blood clots, it increases breast cancer, it increases Alzheimer's." And as soon as that came out, then everybody said, I don't pay any attention to that. It was not a good study. So when it didn't support their preconceived ideas, they decided that they were going to try their best to disregard the information. So this single study caused decades of fear, confusion, and unnecessary suffering for women entering menopause who could have benefited from appropriate hormone therapy. And ever since 2002, there's just been utter confusion. And what has happened is that I've been doing this for 30 years when it wasn't that popular. Now women are asking for it, and doctors are jumping in and they don't know what they're doing. And it's just causing confusion. All right. So guidelines keep changing. Now, the North American Menopause Society, they have retired or rewritten more than 13 position statements on hormone therapy over the years. Here it is right here. These are retired positions. So what they do is they say one thing and then something else comes out and they change it. So everybody's confused. So treatment decisions are often made without checking your individual hormone levels, leaving doctors to prescribe based on symptoms alone. And that's what happens. They get a blood test, and if you're postmenopausal, the estrogen is always low. And they may give you estrogen and the blood levels never go up. They can't figure out why, because the blood only shows what is coming from the ovary and nothing is coming from the ovary. So if you give estrogen from any other source, that they give you a pill, a cream, a suppository, you don't see it in the blood. You also don't see the estrogen that your fat tissue is making because it's not coming from your ovary. So, despite changing recommendations on treatment, there is still no consistent protocol for hormone testing before treatment. So, they've done all these position statements, and there's still confusion. You see, there's only 9% of the residents think that they even know how to deal with menopause at all. So now this is this is even worse. So now they're trying to have legislation to train doctors about menopause. But you know what information that they're going to use to train doctors is this. Okay. So it's just going to legalize confusion. That's all that is going to do. And, California loves to be first at something. And they're hopefully this doesn't happen. And again, I'm just one person, but I'm on a crusade for the rest of my life is to try and get people to understand this simple concept. But because it doesn't benefit the pharmaceutical industry, the medical community doesn't want to accept it. That's really the issue. So women must lead the change. I tell you, there's nothing more powerful than a group of women. I used to say when I was speaking, is that when I first started doing OB, uh, it used to be like in I Love Lucy, and probably you don't know, but the women would go in labor and delivery. They would go and have their delivery room, and the men would be in the waiting room pacing the floor, and they were acting, they were treating having a baby like it was some medical complication. And the women of the 60s and 70s and 80s, my generation, those baby boomers, they said, I'm not going to have babies like that. And they changed the way that obstetrics was delivered. Now, if you go to an obstetrical unit, it looks like the Ritz-Carlton. I mean, it's all wood paneling and crown molding and bathtubs where they can have deliveries in the water and all of this. That was changed by women demanding a change. And back 20 years ago, I said women are going to change how they go through menopause. And now I have to tell a whole different generation that you have to be the change. You need to ask your doctor about marketing puts pressure on the healthcare system to respond to patient demands. So you've got to go and I'm trying to teach you so you can teach the doctor and you can refute any information he gives you because you know the truth. So your voice matters. You have the power to transform menopause care. If enough women ask for hormone testing, doctors will have to listen. Believe me, if you go in and demand a saliva test, you tell them where you can get one. And I can teach you how to read it so you can teach the doctor. Okay. And that's, I've tried every other method. And so I'm trying this and I need you to help me, please. Okay. Help me so I can help you. Why testing matters? Because symptoms can be misleading. Similar symptoms can stem from different hormone imbalances or a combination of several. You deserve to know exactly what's happening in your body. Saliva testing provides comprehensive picture of your bioavailable hormones, allowing for truly personalized treatment. And it's very easy. And I've shown it before. You can go and look at some of my YouTube videos. It's just a matter of looking at the estrogen progesterone ratio. There needs to be a certain amount of progesterone to counteract the estrogen that you're making. And you have to make sure that cortisol is not disrupting the whole system. So if you can look at estrogen, progesterone, and even testosterone, and look at the cortisol curve, if you can get those back in balance, your symptoms go away. And they do. So, because you can't give a drug for each symptom. One of the symptoms is insomnia, so then you have to take a sleeping pill. Another one is anxiety, so you take an anxiolytic. The other one is depression, so now you take an antidepressant, anti-depression pill. And then you are gaining weight. So now you have to take thyroid hormone or you take a GLP-1. But all of that can be solved by correcting that estrogen progesterone ratio. That's all you have to do. And if you can count from 1 to 200, you can do it and you can teach the doctor. Now, mainstream media is trying to pay attention. Most doctors aren't trained to treat menopause. Some women are trying to change that. Even mainstream media is, I guess this is National Public Radio. They have health news and it's talking about menopause matters. But I don't know if they're talking about saliva testing. They're talking about herbs and they're talking about, breath work and meditation, and that can help. But what would really help is balancing your hormones. The medical establishment acknowledges the problem, but change is happening too slowly while millions of women continue to suffer unnecessarily. And I can't tell you how many people I hear on TikTok or Facebook, and they're suffering. They're suffering, and it shouldn't be that way. And it's not like it's some expensive $10,000 treatment, or it's not. For less than $400 or $500, you can get testing, you can get treatment. The treatment is not that expensive, and you can monitor it and know that you're not taking too much or too little. So my mission is to equip you with the knowledge and confidence to demand better. Women are very persuasive. I have a wife and she's very persuasive. And you have the power to change this. More comprehensive menopause care from your healthcare provider. You got to demand it. You need to promote testing. You need to teach women how to ask for the right hormone test. Tell them, no, I'm not doing a blood test. You need to order the saliva test. And I'll tell you the company where you can order it from so you can go in and demand the correct treatment. And you want data-driven care. You want to transform menopause care from subjective guesswork into objective, data-driven treatment personalized to each woman's unique hormone profile. I tell women when they come in, they'll say, I have this, I have that. What do you think is wrong with me? I say, I don't know. I have to test you. And even after they've been on hormones for a while, if they come in and some symptoms have changed, they say, do you think I need too much estrogen or what? I say, I don't know. I have to test you. It's just like if you walked into a doctor's room, into a doctor's office and said, do you think my blood pressure is high? What would he say? I don't know. I have to take your blood pressure. Okay, it's as simple as that. It's the same concept. Everybody's blood pressure is different. Everybody's hormone profile is different. It's the same thing. So what can you do today? Request proper testing. Ask your doctor specifically for saliva testing to measure your bioavailable hormone levels before starting any treatment. You can join our Hormone Clarity course. It's in our Ageless Blueprint platform. It's school.com. I'll show you at the end. But join our Hormone Clarity course. It is free. And you can begin to understand how your hormones work. It's not that hard to understand. It's not. It's very simple. And you can share this information with other women. Women talk about all of their little hormonal problems and their irregular bleeding. This is common. Men don't talk about that as much, but women do. So talk about it. Share this information with your girlfriends, with your daughters, with your parents, whoever needs to hear this information. Share it. All right. So you be the change. Menopause isn't a mystery. We just haven't been measuring it correctly. Speak up about your symptoms and demand proper testing and treatment. You want to ask the question, can we test my hormone levels before deciding on treatment? And if they say we're going to test you in the blood, say, no, I don't think so. That's not going to tell me anything. And tell them, haven't you read the textbook? And I'll give you the quote from the textbook, okay? Join the movement to transform menopause care for all women. All right, so you can go to www.agelessblueprint.com. Now, what I really would like for you to do is to go to www.school, S-K-O-O-L. I'm going to have it at the end of this. I have all my resources at the end of this video. once it's recorded and I send it out. But I'll give you all the ways you can follow me on TikTok, YouTube. We have a Ageless Blueprint podcast that I do every Wednesday morning that's recorded on my agelessblueprintpodcast.com. And we would love for you to be a part of this. Please join our school group. We have a message board where we can comment and you can be a part of the community. I'll answer questions there. You can be a part of this question and answer that I have on every Tuesday. But I'm really counting on you to to spearhead this movement. I've tried my best. So I'm asking you to please help me to get this across. And don't let that legislation in California be passed and force doctors to learn bad information. All right. So I'm counting on you to help me out. And I appreciate your time for listening, and for listening to me. And keep following me. I'll have more information that you can use. Okay.